Folks, this is John Dubas with Premier Marketing. Thank you for joining us today. We'll be discussing one of the Medicare supplement options, fairly new to the market, that can make a difference for you and your agency in your key markets, and also, of course, be a great option for your prospects and clients. We'll spend a bit of time discussing it. Some of our folks over with National General are dealing with a little bit of health issues today, so we're going to wing it a little bit when we come to that part, but we have a nice bunch of information for you that I think you'll find very helpful and will help you determine if this is something you want to add to your portfolio, or if it gives you that additional detail you need in marketing this program. We feel that it is a viable product in many of the markets in which it is offered, many being all of them, we'll put it that way. Today's presentation is being recorded and will be made available on our website at premiersmi.com and on our YouTube channel as well. So watch for that as it uploads. You'll notice in the software package that there is a section for both questions and chat. We ask that you put your questions in the questions box. We find that we do cover the majority of them through the course of the presentation, but in the event that there is something that we cannot handle today, we'll make certain we have that answer for you as soon as possible and delivered to you personally. So that said, I'd ask you to perhaps enjoy a little bit of a level set, we'll put it that way, about who Premier Marketing is. I recognize many of the names on today's presentation, but I want to make certain that we all have an understanding that, well, hey, Premier's been around since 1968. We're a national marketing organization. That's part of the Integrity Marketing Platform. We got offices across the country, licensed in all 50 states, and we act as an insurance wholesaler working through independent insurance agents such as yourself through contracts that are at the highest possible commission levels, with recruiting contracts available to those who qualify. And we do so through a full portfolio of products that appeal to the Medicare population particularly, but have breadth across the age spectrum and makes different programs available to you regardless of an individual's age. However, with today's discussion, we'll be speaking of the Medicare programs, specifically the Medicare supplement option that people have to take care of the shortfall that come with original Medicare, but we also have a full portfolio of Medicare Advantage and standalone Part D prescription drug programs, in addition to the life insurance and annuity products, including final expense life insurance and pre-need plans, a full portfolio of long and short-term care programs, disability income plans, and those ancillary benefits, the dental, vision, hearing, critical illness, cancer, hospital indemnity, accident, and telehealth programs that can address a specific need of your prospects and clients. When we look at the Medicare Advantage portfolio, it has the national carriers there for you to work with our organization, and many of the strong regionals as well that can make a difference for you in your market. But many today will have perhaps more of a lean for some of the prescription drug programs, the standalone plans that in many cases come as part of the contract for the MA plans, but it's a viable and necessary component of a healthcare program for someone who's selecting the Medicare supplement plans. And it includes the national carriers once again, as I mentioned. Normally that is a offering that comes as part of the MA contract, a couple of exceptions. The Mutual of Omaha program is a standalone adjunct program outside of their other offerings for their standalone prescription drug program. And the Clever RX program is actually a discount program for prescription drugs. But when we speak of Medicare supplements, we have a full portfolio of products that can make a difference for you in your market, as I mentioned, but we also have different types of support programs that are there to help you be successful in this space. One of the criteria that we follow when we look to contract with organizations is the systems that they bring as well, in addition to the quality of the product standing behind it for both their customers, be it the public or the agent force. So we have a very large selection of these plans, but today we'll discuss National General and the offerings that it has, because I think you'll find some of the things that you'll go, I didn't realize that was part of that offering. When we look at the ancillary products in each of those categories, the national leaders are there for you for your use. These are very helpful, not only to specifically address that need that's covered by the product type, but it's also an additional way to market. Less restrictions in this area when it comes to some of the things that you can do to drum up interest, but it also, as I mentioned, fills that specific need for our prospects and clients, gives us that additional marketing flexibility, but also brings an additional revenue flow for us and our agencies. A great way to do a little bit of combo bundling of products as well. When we look at the Medicare market overall, for those of you that come on a presentation like this, you hear this, the aging of the baby boomers, the silver tsunami, one every 10 seconds, 10,000 plus a day. And when you look at the Medicare population as it ages in, of course, it's near exponential looking as to the number of folks that are covered by that. But there is a number of people pardon me, where they are eligible for Medicare, but they're delaying full access for one reason or another. The pandemic has had a little bit of an effect on this, and people are working longer because of how it affected some of the retirement accounts, things of that nature. But we also have the tail end of us baby boomers, where for us to get full Social Security benefits, you got to go to age 67. So for whatever reason there are a piece of the population that may be eligible for Medicare that aren't accessing it fully. However, that's more than made up for by the folks that are under the age of 65, accessing Medicare benefits because of medical disability, and it makes for a very viable market across the board. Of course, when we speak of Medicare supplement programs, the regulations of what plans are offered to the Medicare population, 65 plus, can be different, obviously, than under 65. We want to make certain, however, that we're covering each of these options and that we are doing so in the manner that best serves our clients. So we're going to look at the different choices they have and realize that, hey, some of them will actually decline the Part B coverage for one reason or another. If they're working past the age of 65, they're in a larger group, makes sense. There are some folks that will just decide, I don't want to spend that kind of money. However, that's not a huge portion of the population. And you'll find some people that will take the base medical coverage with traditional Medicare, add that standalone Part D prescription drug program to help with the cost of medications. And that's what they're doing. However, that is a population that may well have an interest in covering the shortfall in the Medicare coverage, the medical portion of it, through the standardized, modernized Medicare supplement programs, such as the National General program that we will discuss today. And then, of course, there are the folks that will bundle everything into a singular package in the Medicare Part C programs. Sometimes, well, they're referred to as Medicare Advantage plans. On TV, on the commercials, you'll see the all-in-one plans. But we want to make certain in each of these categories, we have the capability of handling the needs of our prospects and clients. And so we're going to look at, well, what are some of their choices? We find that as people are coming into Medicare and accessing full benefits, even the folks that are late to Medicare seniors, that it's been a fairly even split between Medicare Advantage and Med Subs. Changed a little bit over the time of the pandemic, where a lot of the electronic focus was on Medicare Advantage plans by many agents. However, regardless of the choice, we want to make certain that we are there for them with information, and specifically when we look in the Medicare supplement arena, what programs in their home market can make a big difference to them. And so we want to make certain that we communicate properly, translate some of the acronyms that are out there. I mean, this particular screenshot of the CMS website is from a few months ago. And we see, gee, there's 4,420 acronyms defined in this. Well, Medicare has a language all of its own, as many of us are aware. And what we have to do is make certain that we can translate those acronyms for the people we visit with, give them the information they need to make a solid, informed choice as to their coverages, but also remind us that as we go through our presentations, if we use acronyms, we properly define them so the population understands what we're talking about, And in many cases, it gives us the opportunity to limit our use of these acronyms and communicate in the fashion that is understandable to our audience. When we look at the different programs that are out there and when you can sell them, well, we have the traditional election periods that, quite frankly, there's a lot of focus on them already for the annual election period this coming fall because of certifications and some of the other things that come about with Medicare Advantage and prescription drug programs. However, in each of these periods, this is in effect more prone to or pointed at the Medicare Advantage plans, outside of the fact that some of these folks, in addition to these standard periods, have the SEPs where they can disenroll or re-enroll in a different type of program, and that includes the special election periods. In each of these categories, however, it gives us the opportunity to look at Medicare supplement coverage, because if someone already has this type of program, in most states, if they can pass underwriting, you're going to have the opportunity to change these programs year-round based on a number of different factors. And that's important because, well, Kaiser Family Foundation tells us in one of their latest surveys that people aren't comparing their plans year over year, and that can make a huge difference. And it doesn't matter what type of base coverage there is. So if someone is on traditional Medicare and has coverages or self-insures for that, we see in that area that defines the market for Medicare supplements, look at that, almost 3/4 of the population haven't done a comparison year over year. So if we have the capability of offering the premier programs, no pun intended, that fill this space, the different Medicare Advantage plans, and a way of presenting them and delivering upon that information, it is a huge opportunity for us all year round. Keep in mind, there are certain states where you might have guarantee issue based on the birth date of where it falls in the calendar. So there's a number of different reasons too that give us the opportunity to compare rates, compare coverages, all of the different things that come into play because of Medicare supplement plans. And that can affect an analysis of their prescription drug coverage. This is an opportunity for us to do a review in that area as well. And we see that once again, almost 2/3 of the population aren't comparing their drug plans. This, however, is a different type of oversight. So if we're marketing Medicare supplement plans, we don't need a scope of appointment. We can do so compliantly. The challenge is when we deal with the Medicare market and we're speaking to Medicare supplements, you will have the discussion come up of, what about my drugs? If that's the case, we're dealing then with different oversight. We need to make certain that we have the scope of appointment. And I know that might elicit a groan or two from some agents that specialize or point to Medicare supplement markets. However, that gives us the opportunity to make certain that we're taking care of our customers and utilizing that scope of appointment, because there are different products that come on a generic piece of documentation there. It gives us then an opening to speak to other programs as well. So keep in mind, when we market Medicare supplement plans, no scope is necessary. We may have the need for one partially through the presentation because, well, hey, they bring it up. We need to make certain we're prepared for that as well, as to how it fits into our marketing programs and how we approach that program. It's important for us to be able to deliver this information because the resources that are out there available to the population we address, well, by the government, they're not using them. They're not looking at and perhaps reading the Medicare and You handbook that everybody on Medicare gets in October, be it virtually as an ebook or through the mail system, United States Postal System. This, however, is a great piece for us to not only define what doesn't have coverage, full coverage with Medicare, that gives us the opportunity to discuss Medicare supplements, particularly with the population that may not be as familiar with them, or help justify those that have chosen that route with a Medicare supplement for their coverage. A great way for us also then to go into the other areas where, well, gee, Medicare doesn't cover that. Well, here's your proof. Here it is, page 49 of Medicare and You. Or we can just pull up the app that's out there on our smartphones and justify the coverage, the need for the coverage we're offering through electronic means as well. If we need to, we can even go to some of the sources that are on the internet that help lay out the different choices that a person has with Medicare. Because let's face it, in many cases, folks are unaware of their options and how they change year to year, and how we can be a factor in helping them determine what may well be their best coverage for them. And we want to make certain that we're able to do so virtually and in person, and be able to pivot back and forth. So as I mentioned earlier, when we look at Medicare supplement carriers, what sort of systems do they have in play that can help us in this regard? Or is the marketing organization we're working with providing that capability that we can deliver the information that's necessary for a person to study, should they choose to do so, or have it available online where they can go and self-shop before it actually happens? And if we need to consummate that sale virtually, we have the capability of doing so. So we're going to make certain that we speak to that and remind people that this population, as folks age into it, are much more comfortable with electronic means of delivering information and understanding it. But even the folks that have been on Medicare for a while have become increasingly digitally savvy because, well, hey, the circumstances since the pandemic, for one thing, for over a year, our doctor's visits were virtual. That service delivered through Zoom calls or whatever it happens to be it primary care or specialist, or even doing some of the preliminary work for hospital stays or visits to a dentist. It's affected all factors of our life, including celebration of our faiths that are being handled online as well. So in each of these categories, we have the opportunity to deal with a population that is much more accustomed to delivering or receiving the information and delivering their decisions in this fashion. And it gives us then that opportunity for electronic presentations because they're comfortable with it. We want to make certain that many of the folks that are out there with an agency marketing have done so on a complete virtual basis. So do we have the capability of speaking to these programs digitally as well? We find that as we look at the different carriers that are out there, is the advantages that are brought to us by National General. And as Jim says, and I use that same phrase, Jim, is that, the Medicare and You book is kind of the Bible for the Medicare population. No offense to anyone intended in that particular, with that particular statement. However, it gives us then that opportunity of a unique source of truth and help folks realize that, hey, we have options that are non-network based, give us a little bit of flexibility in that area, or for whatever reason there happens to be, there is a strong option for them to take that is not network based. So let's discuss that. Now, our guest presenter for today, Craig Rydzeski, has come down with a bit of a bug. So what you'll have is me ad-libbing on a piece of presentation here that we will deliver to you as well as part of the follow-up of today's presentation. So as we look at National General, we're looking at a program that has a portfolio of senior products for 2022. We'll speak to 2023 when 2023 rolls around, because we find that standardized, modernized Medicare supplements, well, the benefits aren't going to change for us year over year when you come to the base medical. The things that are a plan G is a plan G with whomever the carrier happens to be. What differentiates one program from another is our opportunity to deliver upon a solid product that gives us an economic advantage. How's it priced? How's it underwritten? And how is it marketed through the organization, through the carrier, that give us the options to take this opportunity to market this program in different directions because of the support that is offered. So when we look at who National General is, and pardon me for this, I'm a little hinky here a little bit with some of what it talks about with PowerPoint here. National General is a well-established old name company, shall we put it that way, tracing its roots back to 1939. A little over a year ago, it was acquired by Allstate. So some folks will look at this and go, well, gee, I've never heard of National General. Well, it's been around for quite a while. Now we're looking at 83 years thereabouts, and we have the power of a name carrier behind it that has a underwriting rating from AM Best of A+, which is a very, very strong rating as well. It has that industry-leading technology and a broad portfolio of simplified programs as well. And so, pardon me, let's see if we can make this a little simpler. There's not. What is nice about this additionally is the fact that, pardon me, there was a question that popped up. And Jim, I appreciate it, but I'm not one to label anything with Medicare Part E. It's actually an interesting concept, but I haven't used that terminology to this point in time. I don't think National General has either. But what we have with National General, when we look at their Medicare supplements, you have multiple discounts that are applicable in many of the markets where they're stackable, where it can save almost a quarter off of the premium. It has increasing premiums that have come about, or pardon me, increasing commissions that have come about, and give us that technology that we can make certain that we can deliver upon that information electronically. I'm beating that to death, but it is such a strong piece of the marketing world today in the Medicare space. It bears constant repeating. And so National General does offer that online signature methods through multiple ways. We have a security question that comes into play to make certain that we're speaking to who we speak to, actually, and an electronic signature with voice sign as well. A very nice piece of this, in addition, is the fact that with the e-app, we have quick underwriting decisions, and as the person qualifies for the program, instant ID cards. And that can make a huge difference for us, particularly when we get in the latter part of the month and we're changing coverage for the first of the next month. Someone wants that detail as to, okay, where's my ID card? What can happen with this regard? And so we have then to go back and illuminate perhaps a bit on the multi-discounts. National General offers a roommate household discount. And it's offered to those that are living with someone else 50 plus for more than a year with a max of 3 residents. So they don't have to be legally married, anything of that nature. They just have to be more than one individual in that household with them over the age of 50. It also gives us the opportunity to offer the discount on top of that for folks that are in the same residence that apply for the Med Sup at the same time. So it gives us that roommate discount of that 7% and adds on a 3% discount because the applications are going in at the same time, a dual applicant discount. There's also the opportunity for many individuals that choose to pay annually, where there's an additional discount in this area. And some folks will say, gee, that's a healthy amount. Well, there's a population out there that that's the way they prefer to pay. They want to pay it up front. They want to make certain that it's taken there as well. What is kind of a really cool twist as well with National General is we also have an activity tracker discount of 5%. This is where that Apple Watch or other fitness device can be registered and bring about an additional 5% discount. So when we speak of those stackable discounts, we've got a number here in play that can make a difference for us. Let's see here. I'm sorry, I'm checking on some different things. A question popped up. I'm sorry, I'm not being able to adjust this the way I want to. Bear with me. See if this will work. Might be better. There we go. There's also a way that we can help people with their premiums based on their current situation with their bodies. So when we look at a preferred select ranking with these programs, we're allowing our healthier clients to get the ultimate best rate available from National General. And there are two qualifications that come into play here. The height weight table with no tobacco, and there's one additional medical question that's laid out, and that is, within the last 5 years, has medication been prescribed or recommended for depression? So we have an opportunity here to really bring about the best buy when it comes to the dollars and cents for our clients. That is a reward for the healthier clients that come into play. And we see then that that discount can make a pretty big difference as we age. And so we want to make certain that we're hitting key ages, and do we have the tools that will help demonstrate that for our prospects and clients. Big thing is, where's this available now? So we have a large number of states that had the program's been available since 2021. Those are the states in the blue. And then we have the green states where there was a 4-1 effective for this. And then, of course, Missouri coming in with a 5-1 effective as well. So we have a broad distribution of where these programs are available. And we see that, okay, John, no Washington, no New York, the Northeast. Well, that's part of this offering. You have to sometimes pitch where your arm takes you, and that's part of what we're doing. It is important to note that that preferred select underwriting piece that we just talked about is not available in Ohio, California, and Minnesota, and the activity tracker is not available in Ohio. Ohio has their own way of looking at some things when it comes to Medicare supplement plans. It also, however, gives us some of those extras that we don't normally see with a lot of standard Medicare supplement programs. When you talk about those additional coverage that are beaten to death on television on the Medicare Advantage plans. And one of the things that is offered as part of this program is access to the Amplifon hearing healthcare benefit. And this gives us then an opportunity for our clients to have their hearing evaluated at one of 5,000 plus NCQA credentialed provider locations and free evaluations in Miracle Ear locations. And it gives us then a way of accessing hearing aids at a very low price point to start with, approximately $700. And what we find with this is you have 64% average savings on the MSRP for hearing aids. That technology can be very expensive, and it includes all the major brands and technology levels. It also brings about the opportunity to make certain that this benefit is utilized because it works. You have a year of free follow-up care and 2 years of free batteries and a 3-year warranty with loss and damage protection. So we're looking to help our population that want a Medicare supplement but still need some help with hearing benefits, and that comes into play here. The program also offers access to Active and Fit Direct, and this is a complimentary discount program that includes access to a library of fitness videos, which we see a lot of folks now that are hunkered down perhaps in a residence. They don't go out as much as possible or don't go to health clubs. They do it at home. This is a great way to get instruction in that fashion, but it also gives us then that opportunity for folks that want to go to fitness centers, access through 10,000 plus centers at just $25 a month. There's no long-term contract. They can change fitness centers at any time with no additional cost, and that activity tracking is compatible with 250 plus wearable fitness devices, apps, and exercise equipment. So it not only gives us a way of working out and staying healthy, but also a way to track that. And remember, in many of the states, that activity tracking can be a discount on the cost of their Medicare supplement programs. We also see that some of the differentiators for folks in the Medicare market when it comes to what are the extras that I need, well, what pops up a whole lot? You have the hearing benefit that we kind of discussed as well, but dental and vision are big movers for this population. Demand products, sometimes handled with a standalone program. What we have with National General, however, is an opportunity to help with the cost in this area as well through a senior dental and vision program that comes with it. So you have an optional passive Aetna network where, of course, if you go to a professional delivering these benefits in this network, your benefit lasts longer, basically. Don't have to go to anything that's part of a network, but it's a way to stretch the benefit dollars. And it gives the population we look at and we deal with every day up to a 25% day one major discount on dentures and implant services and those major services, where we see that that is one of the reasons why people really look to add this coverage, because they need that help and they realize how expensive some of those services can be. It also delivers upon 100% basic coverage. And you'll find that as we go through and we talk about having basic dental vision hearing benefits, and we've done some webinars on that specifically as to how that is a strong market for us. Many of the folks that have had coverage in the past want to continue the basic coverage as well. They want to go in for their examinations and cleanings, and they want to make certain that any type of need they have be covered as thoroughly as possible. And that can include the denture repairs that are covered under the basic benefit with this program. And keep in mind that full mouth x-ray is covered as preventative with this program as well. For those of you that have been to the dentist lately and have had that done, well, it's not the same cost as an implant, obviously, but it's not entirely inexpensive either. When we look at some of the programs that are out there then as part of this, what are they getting with some of the dental pieces that come into play? Well, there's a 10% preferred discount for individuals based on some of the needs that they have and what they've had in the past. And keep in mind that there's a bundling of these programs where the dental plan is paired with either the Med Sup or Senior Dental Indemnity program on the same application. You get a discount as they buy more than one program. And keep in mind, the more product you have in the house, regardless of whom the programs are offered through, the carriers, it really drives up your persistency, your retention, if those programs are with you. And we'll show you a graph on that in a bit. We look at some of the availability of these programs. We see that basically the central part of the United States into the eastern coast, very solid offerings across the board, and Idaho is coming with this coverage as well. So this standalone program with the costs that come as part of it, well, it can be very, very helpful, obviously, if we're marketing in one of those states. We also have the opportunity to look at some limited medical and association plan benefits, and these are programs that are available for folks with specific needs. So the My Life Senior Association plan that provides the discounts on diabetic supplies, gym memberships, the dental, vision, hearing expenses. And this is important because depending upon the plan that they select, are we getting full coverage on some of those things that can really add up? And as a diabetic, I can testify that the test strips aren't inexpensive. Are they going to break you? Well, no, but if you're looking at someone on a fixed income, that can make a big difference, that particular cost alone. And it gives us then also the access of a very crucial benefit that came to fore during our seclusion or sequestering in our homes, whatever it happens to be, of the telemed benefit, where a bunch of this is being done all virtually, as I mentioned before. It also gives us the opportunity to offer discounting programs on podiatry, LASIK, the lab screenings, the chiropractic, and alternative care programs. Because keep in mind that Bible that we referenced before that Jim brought about as well, and thank you for that. I don't feel so badly of using that terminology now. It gives us then that opportunity to make certain that they realize that some of the things they may assume are covered may not be, and how can we help with those costs. Before I had back surgery, I took advantage of an acupuncturist that was close to my office at the time. And that made a huge difference. And there are some devotees in the Medicare population that carry on with that practice as well. And what does Medicare cover with it? Chiropractic? Well, what's covered and what's paid may be a couple of different things, but we want to make certain that the folks that go for standard adjustments or whatever it happens to be, not subluxation of the spine verified by x-ray, we want to make certain that we can help them there as well. So this gives us a niche offering for those that don't have, or perhaps it's that population we mentioned that might have declined that Part B coverage, or we're dealing with a spouse or roommate that's not on Medicare, but has need for these programs and doesn't qualify for Medicare at this time as well. Keep in mind that these are fee-for-service programs, so those benefits are paid in cash to the insuree to help with those expenses. When you look at the availability of these programs as well, you see a broad offering in that area, with more states coming available as well and have come available this year. Let's look at some of the things that we can do with National General when it comes to quoting and enrolling. All well and good, John. We've disseminated the information. You've even actually talked us into delivering the scope of appointment because the person wants to talk about medications. We're utilizing some of the systems that are out there to capture that scope and store it. How then do we consummate the sale? Well, we have programs we'll discuss through our organization, but one of the reasons, as I mentioned before, why we work with specific companies is the programs that they offer on taking care of the population we address and taking care of it. And this means getting them going with the coverages that they select. So you have a website that really helps make this simple for you for National General programs, where you go to nationalnatgen.com. You use a username and password that is the same for those that utilize the portal that you want your agent site to track some of your information. And it gives us then the opportunity to set this up very simply. So as we log in for the first time, it gives us the opportunity to receive the instructions on how to go about setting this program up. And then, of course, you've got the agent support available through the organization, through a toll-free number, to help with this initial setup or challenges that you may have in this area. That does bring about then the talk of, okay, John, you've got this site, it helps us enroll. What were you talking about with the agent site? Well, the agent back office with National General gives us that opportunity to use that same user name and password, or username and password, and quote and enroll through the system this way. It gives us then different ways of accepting signatures as well. So if we're doing some things electronically, we can make use of a security question, mother's maiden name, favorite pet, all those lovely things that come into play there, the passphrases that help us protect all interest involved. There is, of course, an electronic signature option through email, or we could do a signature telephonically, where we have a voice authorization process to get this underway for folks selecting National General. It's also really cool in the fact that a neat piece of this where National General is available through the CSG actuarial tool. And for those of you that are familiar with our organization or our Integrity Platform partners, that's part of our Medicare Center program. And it gives us then that opportunity to utilize that system that we may be very comfortable with as well, and pump in the numbers or the information that's necessary to run that quote, basically where they live, the other details. It's really neat because it will deliver the underwriting classes there for us. It gives us that opportunity to add that activity tracker that we talked about under the discounts that are available in that system. That annual pay discount really reflects the difference in the program's cost as it's selected. And then, of course, it helps with bundling that roommate discount where it's calculated there in that fashion as well. And keep in mind, this is an additional 3% discount, so 10% overall for that discounting system. A great way to drive down the cost on very strong programs. So what we have then is an opportunity to also utilize a resource within the organization. For those of us that reside in the Dallas-Fort Worth area, well, that's where Craig lives, in this area. Offices in this area, but of course it's a national presence for you, and you have him as a resource should it be needed. Of course, you still have a way of accessing information through your agent success manager, your marketer here with Premier as well. But it's nice to be able to go to the source, the guru on top of the mountain, the well, you know what I mean, the source of truth. And you have that then with Craig in this particular instance as a source for you. So you've got his phone number and you have his email address as well. Keep in mind, this is recorded. You will have access to the link to this presentation. So for those of you that I've caught without pen and paper, well, you'll have access to this information very, very shortly. So what we have is a strong option within, pardon me, the Medicare supplement arena. And what we have then is, why do you want to do it with Premier? Well, there are a number of things that we can do to help you be successful in this space. And that includes doing some electronic contracting, particularly for those ancillary programs that I mentioned. When we look at contracting for National General, we're going to do some things directly in order to facilitate speed in the contracting process. But keep in mind, when you're dealing with a carrier that's offering Medicare supplement plans and additional benefits, ancillary benefits, as we spoke of with their DVH programs, you don't have to deal with that certification. For many of you that you're going through that now with Medicare Advantage programs, this program, however, does not require any additional certification outside of what's required by your state for your license and for your own means of making certain that we can offer this compliantly. What do you mean by that, John? Well, basically, that's walking that fine line because of some of the questions that will come up from the Medicare population as, what about this? We want to be prepared to make certain that we can address those questions compliantly and then deliver a solution as well. And this helps us set up those additional carriers that may be necessary. We spoke of National General and the coverages they have for dental, vision, and hearing. There are a number of folks out there that are very interested in cancer or critical illness programs. And then, of course, the need for hospital indemnity programs. We'll run across some folks that, hey, I'm in an MA plan, I'm sticking with it. What else can you do for me? Well, that might be the thing we need to do. We do also offer discounted errors and admissions coverage for qualified agents. What makes you a qualified agent? You got a contract with us. But this is a program you own. It's not like being added to a blanket E&O policy for one or two carriers, and then you wonder how you're going to satisfy that requirement for everyone else. We realize that no matter how big an organization is or how robust the portfolio of products that they offer are, well, nobody has everything. And most agents do not have every product in their portfolio with a single organization. This covers you across the board, regardless of whom you contract with. And then, of course, we also look out for your license. So you have discounted continuing education bundles available through our association with WebCE at strongly discounted rates. And as an independent agent, since you are also maintaining your own benefit package, what are we going to do to make certain that we protect our own ability to earn? So you have a program available to you through a modified guarantee issue on a modified guarantee issue basis for non-cancelable DI programs in which you're paid a commission on a product you're picking up for yourself. A great way of adding to your own portfolio. Now, keep in mind, if you run across a population that's looking for DI coverage, I use an acronym there, that's looking for disability income coverages, Katie Novotny has some really strong programs that can help you in that regard. This is for the broker population and not for the population that we're working with day to day. Much as where today's presentation is being recorded, past presentations have been as well. As I mentioned, they're available on our website at premiersmi.com and on our YouTube channel. But this gives us then the opportunity to look at programs that we offer, such as Medicare supplement programs, such as programs specific with National General. How do we reach out to the public and make use of the resources the carriers and marketing organizations make available to us? Well, there's different recordings in there that talk about addressing the faith-based population, the organizations there with whom we market. We're dealing with providers, because keep in mind, not all doctors and specialists are in a network, and they need help when it comes to protecting their patient base as well, and having a way of marketing to them to help with maintaining their payer mix through MedSup programs can be a very, very viable way of reaching into that population with a bit of a different twist than you'll see with some of the other agents that are marketing in your area. So you'll have access to those different hints and tips and trainings, presentations we've done in the past on 2 different social media platforms, or internet platforms anyway. I spoke of the fact that the CSG program is available through our Medicare Center program. I cannot stress the value of this program any greater than I don't know how to really bring about the fact that this has incredible value to you. It's available without cost to you. Boy, that's a XMA agent's speech, isn't it? Let's paraphrase JJ Walker off the commercials. It's free to anybody who contracts with us. We have a singular logon for multiple quoting engines and other tools. And this includes in the Medicare space, particularly the programs that are powered by ConnectSure, Sunfire, and CSG. They're all part of it. Single login to access them. It gives us then the opportunity to collect that scope of appointment when appropriate and store it, whether we sell that individual or not. That's a 10-year storage requirement as well. So keep in mind, it's not just if they're our client. If we presented, we need that scope on file. It gives us then that opportunity to do side-by-side plan comparisons. It allows for a strong customer database within the program, a CRM that's available to you without cost, and then, of course, other learning center resources that help us be more effective in the space. Particularly when we're talking about Medicare supplements, what about hints and tips when it comes to marketing for that? What kind of scripts are available? Those sorts of things. You'll find those resources within Medicare Center as well. We feel that it's so important that you realize that your compensation for the sale of these products may entail extras. So we have a page devoted on our website that help you in that regard. Medicare Advantage and Medicare prescription drug plans, well, the max compensation for that is set by the government. So you don't see bonus programs or marketing incentives come about with those programs. However, that is a pretty common factor when we look at what is the MedSup going to pay me outside of my commission. Is there anything else? Many of the carriers do offer incentives there, and that may help you qualify for trips that they offer and other incentive programs we offer here at Premier Marketing as well. So we want to get you in front of people. You can still smile and dial for MedSup if you choose to do so. We have custom calling lists made available to you at low or no price, depending upon your contracting situation with us. Butt it up against do not call so you can market in that fashion. We have, as I mentioned, with some of those recorded webinars and things that we do live from time to time, how you reach into the community with those centers of influence and effectively market there. Sometimes the carriers will come up with prospects for us. We see that a lot during the annual election period with Medicare Advantage or prescription drug programs, where if we've worked with them, they work with us. That whole quid pro quo, you scratch my back, I'll scratch your situation. It gets in front of people where we can offer the most appropriate program for that individual. We do have an internet lead program and direct mail support, a really cool T65 locator that I'll speak to in greater detail in just a moment, and a way of reminding us through a referral program that speaks to a means of taking one lead and having it go forth and multiply. Jim, we're going to carry that Bible analogy to this, where we're casting our bread upon waters and we're speaking to the opportunity to expand a lead from a singular individual to multiples just by certain words and tips and timing as to when we take advantage or speak to the need for referrals. That mail program, it is a discount program based on production. You can qualify two ways: through health programs, and that includes the Medicare supplement plans, and through a final expense program as well. So you can qualify for 2,000 pieces of mail each month at discounted rates should you meet the production requirements that come of it. And we do so through preferred lead vendors. We vet these organizations. We want to make certain that the systems they offer can get that lead to you as quickly and as in a fashion that allows you a greater opportunity to close it. Get it while it's hot. These programs all have different marketing databases that make this available to you as quickly as possible. And the letters that go out are vetted by our organization. We have a library of letters set out with these different companies to make certain that we keep everyone in compliance as well, protecting ourselves for our greater good. For those folks that don't want to spend the money for an entire campaign, or they have other marketing efforts that bring about a balance of their scheduling of appointments, and they just need a few to plug in some holes here, well, access to the YIG, never distributed direct mail programs or responses, is a great way to do that. These are direct mail leads that have never been touched, that are fresh, that give you an opportunity to plug those holes. Now, the cost will vary from area to area and from time of year to whatever time of year it happens to be, season to season. Supply and demand comes in play there, but this is as expensive as I've seen these leads at any time through our association with this organization. So it's a great way to buy what we need and plug in those holes in our calendar. The internet lead programs are based off of the lovely social media piece called Facebook. We have one in play for final expense and one in play for Medicare leads. Keep in mind, when you deal with social media, you have a microwave response. You can kick something out there if you're directing your own campaign and get a fairly quick response, or buy them like it's here. The whole "though that they will come" doesn't necessarily always apply. This, however, predicates a very quick response as well. So part of the microwave mentality that we have in the world today, we want to make certain if the leads are coming quickly, we're responding quickly as well, because they're probably talking to more than one organization in that area. That T65 locator that I mentioned, well, you can door knock for med subs. You have to be careful about how that might bring about discussions for MA or PDP programs, because then you're walking a fine line. But this is a complimentary tool. Once again, J.J. Walker, it's free for agents contracted with us, where you download this program to your smartphone, to your desktop, you register through the piece there. Well, gee, that lower corner, register here. That then starts the process, and it says, hey, well, this person does have a contract with us. They get access to this tool, and then we can actually plot out where people live that have an opportunity to be clients of ours, if we want to put it that way. It says, okay, we're in an area, we got 3 appointments in a row, the middle one cancels. What do we do? Well, we're going to market in that area. This might be a way of identifying people that are in need of our services based just on that fashion. Keep in mind, you don't need a scope for med subs. The topics come up that does require that document. You need to be prepared to deliver upon it. But this is a great way of identifying people in our target market geographically. That referral program, it's not just part of the sales process. It is also a piece that comes about when we're engaging the folks that we've already done business with. So our book of business, how do we go back and mine that for referrals as well? So this is a very handy recording that just reminds us of some of the things that we may have done in the past and have gotten away from because, hey, they were actually effective, or we haven't done anything in that area. How can we then make our leads grow without buying more of them? Well, here you go. Referral program that can do that. We do all this because we want your business. We want to be referable to your friends within the agent community. And it gives us then the opportunity with programs in a Medicare supplement arena, particularly with National General, that is very, very easily added to our personal marketing program. Doesn't require those certifications. The contracting process is fairly quick. You don't have to deal with a time lag in that regard. It then can be a key factor in the portfolio that you're offering in different markets. And as John Wayne says in the movie The Cowboy, slap a piece of bacon in that biscuit, saddle up, let's ride, because hey, we're burning daylight. That's paraphrasing it, of course. A little caffeine thrown in there as well. But it gives us an opportunity to offer this very quickly. So we don't have to wait around for, okay, we're doing our certifications for MA and PDP in the fall, but it's for 2023 products. We can't even talk about them till the 1st of October. Can't sell them till the 15th. Well, this is something that's different in that regard. And so we want to, at this particular time, make certain that we cover any questions that may be in play. We saw one that spoke to asking about the E&O coverages. We'll swing back to that very quickly. Here we go. It's through 360-degree coverage pros, and here is the URL to access that full detail of the information. So 360coveragepros.com/PSM, Premier Senior Marketing. It then gives you the details on this program and how you want to proceed with that coverage. There we go. I think we've covered the questions that are there. At this time, we're almost at the top of the hour. I've taken an hour of your time, your most valuable asset, and I want to thank you for investing that with us here today. For those of you that have done business with Premier in the past, I thank you for that business. And this may be an opportunity to broaden that relationship through our association with National General and other programs as well. For those of you that are coming on and looking at and considering this coverage, this opportunity, I thank you for that as well. But as I mentioned, I really appreciate you investing the time that you've put in with us here today. I want to thank you for that opportunity of delivering this information to you on National General and how it can be a help to you and your portfolio. It's truly appreciated with that investment. So until we're able to visit again in the very near future, at this time, I offer you a thank you and good selling. Thanks so much. We'll talk to you soon.